Okay, so code blue in office emergencies. So code blue is called when there's someone in the office that is experiencing one of these five symptoms. So respiratory distress is basically when you're having trouble breathing or you're like they're not able to breathe. Unconsciousness is when they're unresponsive and cannot be aroused. Anaphylactic allergy reaction is basically when there's a visible swelling and it may affect breathing due to an allergic reaction. Seizures are involuntary physical movements and shaking leading to unresponsiveness. And then you can also have chest pain, which is debilitating pain in the chest or the arms. So those are the five areas and five experiences that we want to make sure that we are able to recognize them to call a code blue. So I'm going to go in a little bit more detail regarding those five medical emergencies. So respiratory distress is when they can't breathe. It's like they're choking and they're having difficulty breathing. For instance, they may look like they're having an increased effort in breathing. They may be breathing faster. They may be trying to gasp for air. They also may be looking pale. So in this case, you want to make sure the person who identifies this respiratory distress calls a code blue situation. Another medical emergency is unconsciousness. This is a person who is not awake and we cannot arouse them. So when a person's sleeping, you can kind of tap on their shoulders and kind of wake them up. But even after, like you're tapping on their shoulders, you're trying to shake them a little bit, like over here. They're not able to wake up. That tells me that they're unconscious, and we want to call a code blue in that situation as well. The third medical emergency is an allergic reaction called an anaphylactic reaction. Now, this isn't just as simple as someone having hives right now, but anaphylaxis is a potentially life-threatening allergic reaction. Common causes of these can be like if they're allergic to penicillin, bee stings, aspirin, eggs, latex, peanuts, any kind of nuts. They have a reaction to something. It can cause them to have trouble breathing since their airways may be completely shut. You may also notice that like their heart is racing a lot, their lips may get swollen as well. They might have a hoarse throat, a hoarse voice. They might be wheezing. They might have nausea. They also may be like vomiting and may get dizzy. It may come out quickly or it may take a longer onset for it. But we want to make sure that we call a code blue in that situation as well. The fourth medical emergencies that we're going to talk about are going to be seizures. So there's different kind of seizures. You can have petite seizures or absent seizures where they're just kind of like glazing up and stuff. But in this case, we want to look out for like grand mal seizures. When they come, it comes in two phases. You can have like the tonic phase and then you have your clonic phase. So the first phase, muscles start to become stiff and the person can lose consciousness. They may fall to the floor. And then after that is when they start having their arms and legs will start rapidly jerking and it may be more rhythmically. It's important to also time these seizures. And biggest thing with all of these emergencies is to remain calm and go from there. And then the last one, we have chest pain. These are usually not going to be so common in kids. It may be more common in like adults and like grandparents and stuff. And this is basically when they have like a tightness in their chest. They may feel like there's a heavy weight on their chest and they can't really breathe. Their arms may be starting to hurt as well. So we just want to recognize that and call a code blue. And so, whenever you do have these medical emergencies, it's important to recognize them so that way we can have the following steps taking place. So, if a staff member finds a patient who is in this medical emergency situation, it's important that they call a code blue, and then you do so by saying code blue in whatever room or situation they're in, and then you repeat that twice. It's important to stay calm and collective because if you have more chaos, it's just not going to be beneficial for the patient or the person in question. And then the doctor will immediately come into the location and then begin emergency treatment as needed. And the doctor will be the one who's going to determine if 911 should be called. The office manager will also come immediately and call the most senior RDA to the office at the location to assist. They'll bring whatever they need for that medical emergency. And then the officer manager We'll also call 911 if directed by the doctor. All the other staff, it's important that they stay in place. They want to make sure that we keep the other patients and families occupied and distracted as possible. We don't want to create a chaotic environment while we're trying to manage this medical emergency. So it's very important to remain calm and collective. We want to make sure that we're able to do what's best for the patient or the person who has the medical emergency. Thank you.